Hi and welcome. I'm trying to learn medicine. Today, cervical erosion. And after we've done it, we're going to do shoulder and pinchment. No, we're not going to shoulder. Neck stretching. And if you participate in the neck stretching, it is at your own risk. And this is no medical advice, we're just learning about it. And this is about a medical condition and bad medical condition, and also internal anatomy. And this subject is not a family-friendly subject. Cervical erosion. An alternation in the outer covering of the cervix, the neck of the uterus. Okay, the outer covering of the cervix is alternated. It changes from its normal pink, smooth condition to a red, grace-like one that often oozes a slight discharge. Grace? I don't know the word grace. Okay. The condition is very common, particularly in women who have had children. It is harmless and never leads to cancer. Symptoms. Many women have no symptoms. The erosion is only discovered after routine internal examinations. We call it alternation in the outer covering of the cervix, but it must be a little bit more than just a color change. In others, there is a yellow, green, or occasionally brown discharge from the vagina and occasionally low back pain. That is interesting. Now the book is from the 80s, maybe something has changed, but it would be interesting if at the list of things which can cause lower back pain, at the one point cervical erosion would be standing. So it must be more than just a color change. When you consult the doctor, if you have the symptoms described, which were that there is yellow, green, or brown discharge from the vagina. What the doctor might do, carry out an internal pelvic examination and take a cervical smear to exclude the possibility of cervical cancer. Cauterize the area of erosion. This is a painless and quick procedure. Cauterize. Prevention. There are no means of preventing the condition. But as I said, it's particular in women who have had children. There are no means to prevent the condition, and outlook: in most cases, the affected area returns to normal naturally. In others, cauterization heals the area. It goes back to normal. But it can cause low back pain. Now let's go to a few things more interesting. Let's go to the part of the low back pain. Occasionally, low back pain. Now the question is the low back pain from cervical erosion or for something else? Which causes normal with cervical erosion, but which is cosmetic. And the other key points were that it does never lead to cancer, and the affected area returns to normal naturally, or through cauterization. That was a cervical erosion. If you were here for medicine, you can go directly to the next part of medicine. And again, this was a little bit like medical advice. This is no medical advice. I just read what is written in this book from the 80s. Normally talk about it. So if you were here for medicine, learning about medicine, not for medical advice, learning about medicine, then you can go directly to the next part of medicine. We are doing now the Neckstretching. If you stay and participate in the Neckstretching, then it's with your own risk. Golden still in sense, legs a bit over shoulder apart, and we're doing the hydro tower. We're breathing in, lifting the arms up, and we're reaching with the fingertips as far as we can. Again, I don't want to say it. If you participate in it, it's with your own risk. And again, down and reach as far as you can with the fingertips. And again, up and reach as far as you can with the fingertips. Then again, down and reach as far as you can with the fingertips. And now a similar exercise. Now arm circles, the arms at front, and again, reach as far as you can with the fingertips. And not just to the side, but also back, reach as far as you can. Down and reach in front as far as you can. And now, that. The feet are standing together, arms up to a T, and now with our wings, not a T, and we're pretending to fly like a buzzard. The buzzard flies slow. And the next exercise, we'll pull these arms up. We're breathing in and lifting the arms up. And out, we're opening the arms to the side. Lifting the arms up. Out, open to the other side. Lifting the arms up. And out and down. Now the legs shoulder wide apart. We're breathing in. We are tall up, having the shoulders back. And out, we bring the head over to one side. Breathing in. And out, bring the chin down to the clavicle. And breathing in, lift the gaze. And turn the head over to the other side. Breathe out. Breathing in. And out, chin down to the clavicle. Breathing in, lift the gaze. Turn the head again over to the other side. Now breathe in. Breathe halfway out. And then go in a circulatory movement over to the other side. Breathe again in. And out again in this circle movement over to the other side. After having breathed out. And into the now with feet standing together, and we're doing the crab in the morning. We're breathing in, lifting the arms up. And breathe out, lean back. Draw the shoulder blades together on the chest to the sky. Again, in the arms up. And out and down, draw the shoulder blades together. Again, in and up. Bring the hands to touch, and now lean back, breathe out. Read in the wind. Middle. And breathe out, lean back. Again, into the middle. And out now lean over to one side, with fur in the wind. Breathe again in. And out over to the other side. Again in. And out and the arms down. And now we'll fly, the hands together, the elbows together, turn up and lift the arms up and keep the elbows together as far as you can come with moderate effort. And release again. And another time. Up. And again down. And now, laying one hand on top of the other one, turn up, breathe in. And out, reach in front and bring onto the head down, reach in front, bring your shoulders in front. And again up. And out, reach again in front, bring the head a bit down. Again up. And on to the next exercise. A combination of the three exercises. We're breathing in, lifting the arms up. And then we're breathing out, leaning back, drawing the shoulder blades together. Crab in the morning. Second exercise with screw, intertwine the fingers or cross the arms, reach high. And now we drill, breathe out, reach in front, hold over back. Again, in up. Out, lean back again, we crab in the morning, draw the shoulder blades together. Again, in and up. Again, in and up, across the arms, intertwine the fingers, reach high. And out in front, hold over back. Again, in and up. And out with the arms down. And now the calf feet are standing together. Intertwine the fingers behind the back. Turn up, shoulders back. Breathe in. And out, bring the head over to one side. And the chin down to the clavicle. Breathe again in. And out. Pull the hands down to the ground. Again in, lift the gaze. And out, bring the head over to the other side. Turn up, shoulders back. Chin down to the clavicle, breathe again in. And out, pull the hands down to the ground. Again in, lift the gaze, bring the head back into the middle, and now stretch of Venus. Legs shoulder wide apart, intertwine hands back and back, bring the hands up to one side, turn up, breathe in, shoulders back, and out, turn the head over to the side where the hands are, and the chin down to the clavicle. Breathe again in. And out, pull the arm and then the shoulder down. Again in, lift the gaze. Out, turn the head over to the other side. Bring also the hands over to the other side. Breathe again in. And out, lower the head down. Pull the arm in and the shoulder down. lift your gaze, turn the head back and now the feet staying together. So breathing in, lifting the arms up. And we're breathing out, we're leaning back with long arms, this time the sky hugger. Then again up. And out, lean back. Again. Out the arms down, and we're doing eagle's wings. Breathe in, lift the arms up. And out the arms down. Again, in the arms up. Out the arms down. And we're ending with a cactus connecting its stings, breathing in. Bringing the hands to touch and bringing the hands down to heart center. That was the neck stretching. I thank you very much and until next time.